the homunculus is the sensory cortex of the brain. It's basically the map of the body as to where the sensory components are. So if you search homunculus man, you'll see this very deformed looking man where the emphasis is put on the hands, the feet, and then the face and the mouth especially. So this is the real estate that our brain gives to these certain parts of our body. Now, obviously, there's going to be more to the hands, the feet, and the face because we have a lot more sensations there, and we need to have that real estate of the brain focus on those areas. Research has found through functional MRIs that when someone has an injury to a part of the body, that area of the homunculus, that sensory cortex, is actually what they call smudged. It's not clear, it's not clearly defined. The person doesn't have a lot of blood flow happening to that area, and the brain just kind of starts to forget about that part of the body. Now, this is really dangerous when it comes to injuries, is because if your body doesn't even sense that area, there can be a lot of mistakes that can happen, a lot of instabilities, a lot of problems. So when we're treating patients, we want to focus on refreshing this homunculus, which actually your brain is remapping itself very often. Your homunculus is always refreshing itself, trying to kind of take stock of all the sensory components of your body. Research has actually shown that if you give someone that has a chronic injury magazines per se, and have them circle that part of their body that's injured, say it's the right hip, circle all the right hips in this magazine, they'll miss the mass majority of them because their brain even stops seeing other people's right hips because it's just not part of the sensory cortex. There's no real estate to that area anymore. When we're treating patients, we really want to make sure that we refresh the brain, highlight this area so that the body knows how and when it should move. We do this through treating the mechanical dysfunctions, but then really it's that neuromuscular component, getting the muscles to fire and stabilize that area, which will refresh the homunculus and bring that sensory cortex back to where it needs to be.